My name is Liz Guantai. I am a lawyer and I am a Women Deliver Young Leader, class of 2020 to 2022. I focus on the achievement of Sustainable Development Goal number 5, as well as number 3, there is gender equality and healthcare. And I also have a keen interest in social economic rights, and particularly inclusion and participation of communities and those communities that are marginalized and disadvantaged. I am very concerned about the effects or the impact of the pandemic on the lives and the health of girls worldwide, and that inspires my choice of topic today. The World Health Organization declared that COVID-19 had reached the level of a global pandemic on March 11th, 2020. The World Health Organization further called upon governments to take responsibility for their citizens' health by undertaking urgent action to curb the spread of this virus. Governments rightly responded with various measures, which included stay-at-home recommendations, closure of public amenities, curfews, travel restrictions, ban of public gatherings, etc. The COVID-19 pandemic has already had a devastating impact on the world's health economy and has disrupted livelihoods for millions of people globally. Young people continue to be disproportionately impacted by the consequences of this pandemic, and especially adolescent girls. With the majority of countries closing schools during this period, the stay-at-home measures for school-going girls continued to pose a predicament on the safety of these girls and access to sexual and reproductive health and rights. And this was recorded and indicated frequently by media and UN reports. This is especially worse for girls residing in rural and informal settlements, noting that these girls were already marginalized from access to these services even before the pandemic. In order to ensure the physical and emotional well-being of adolescents and youth, it is important to consider how their rights to sexual and reproductive health have been disproportionately affected. There is need to employ measures that will consider the specific needs of this group as the fight against the pandemic continues to take momentum. What are these sexual and reproductive health challenges that are being faced during this time of the pandemic? First, there is gender-based violence. Across every sector, from health to security and to the economy, the disproportionate impact of COVID-19 on women and girls cannot be underpinned. Following media reports and police records, it is obvious that the pandemic has magnified the already existing structural and power inequalities that condone violence and discrimination against women. There's an increase in rape and defilement. For instance, in Kenya, as at June 2020, data from the Director of Public Prosecution recorded that sexual offenses formed 41% of the total cases reported since the onset of the pandemic in Kenya in March 2020, with the majority of the victims being women and children. Most of these offenses sadly occurred in domestic settings. The perpetrators were relatives and persons living with the victims in a domestic relationship during quarantine, and this quarantine is as a result of a government measure that has been rightly put in place to curb the spread of the pandemic. Looking at traditional rural settings, girls are even more vulnerable to the risk of FGM at this time when schools are closed. With the tough economic conditions, there's a higher risk of child marriage for adolescent girls in exchange for money or bride price. There's a further risk of these girls being exposed to child prostitution in an attempt to get money to offset the household or their personal expenses. Restrictions imposed during COVID-19 are likely to discourage victims from seeking medical treatment or reporting cases at the police station. and especially during curfew hours. In cases of domestic violence, for example, the survivor may be forced to stay at home with the abuser, increasing the risk of violence and control. As a response strategy, organizations have responded, and we've seen a lot of civil society organizations, NGOs, trying as much as possible to utilize digital platforms and social media to create awareness on the impact and the effects of gender-based violence, as well as prevention and response in the home settings. It is very important to continue sensitizing the public on safety during this period. To let the survivor, sorry, it is very important to continue sensitizing the public on their safety and the safety of others during this period, and to let the survivors know that there is help available, to know of the available channels for response and treatment, in addition to facilitating temporary shelter for them. The second issue I would like to address is teenage pregnancy. According to World Health Organization, an estimated 21 million girls between 15 to 19 years get pregnant annually in developing countries, with 12 million of them giving birth. Noting the increased rates of GBV and child marriage during the pandemic, this number of teenage pregnancies has increased since the onset of the pandemic. With the curfews in place and limited financial support, access to maternal health care is a big challenge for pregnant teenagers or pregnant adolescent girls. This is in addition to the stigma that is associated with teen pregnancy. There is a reluctance in providing comprehensive sexual education in many countries, which is considered as a taboo. As a result, there may be increased unprotected sexual behavior among adolescents and young people, and this is cited as one of the causes for increased teenage pregnancy, with conversations on sexuality being considered a taboo in many households. Many adolescent girls lack knowledge and empowerment to enable them make informed sexual decisions. There is need to ensure that these girls are empowered and they are able to know the conditions in which sex should occur. They should also be, the girls who are already pregnant should be allowed to continue their education. They should be able to access antenatal and maternal care for themselves, as well as baby care services for the children. The other sexual and reproductive health rights issue that I would like to address is access to proper menstrual health and hygiene. Menstrual health and hygiene is a big challenge for girls and women from low income areas during the pandemic. With the strained financial resources and lower household income, affordability of sanitary hygiene products is a challenge during the COVID-19 pandemic. This puts girls at risk of using unsanitary alternatives or engaging in sex in exchange for pads. The situation is worsened by the shortage of clean water in urban informal settlements to sustain good menstrual hygiene. There is need to ensure that sanitary hygiene products are free for girls in low income areas, and preferably they should be included in the relief care packages for COVID-19. The fourth issue is access to healthcare for adolescent girls living with HIV. With a greater health priority geared towards COVID-19 prevention right now, there's a general decline in concern for other um, for other health for other health issues, and in particular HIV prevention, treatment, and care. Young people living with HIV and who may not be on treatment or virally suppressed are at a greater risk of reduced immunity. With the COVID-19 restrictions that were in place for the period following the declaration of the global pandemic, the young people living with the HIV were less likely than before to visit health facilities for HIV testing. The need to curb the spread of the virus necessitated the avoidance of gatherings and mass activities. therefore reducing community outreach and advocacy on HIV matters. It is important for health based and community NGOs and organizations that are advocating for health issues to consider strategies that are youth friendly and convenient to young people living with HIV. For instance, an NGO in Kenya called Inarela Kenya delivers self testing kits to young people at their homes and specified facilities, in addition to linking them with immediate treatment and psychosocial support for those who test positive. Another challenge for people living with HIV globally is the disruption of clinical visits and routine hospital checks because of transport interruptions and movement restrictions. In this regard, organizations such as Inarela Kenya continues to deliver counseling for people living with HIV on telephone call, as well as facilitates home delivery of the ARVs where access to the client health facility is otherwise incapacitated. So this provides a more assures the client of access to the treatment as well as convenience and privacy. Having looked at these issues, the issues which affecting young people and especially young girls, teenage girls, adolescent girls at this time of the pandemic, what are the recommendations? Governments around the world have made remarkable steps towards COVID-19 prevention by enacting measures such as stay-at-home measures, restriction movements, avoidance of gatherings, etc., to curb the spread of the virus. However, little recognition has been given to the fact that as people self-isolate and as people take care not to get this virus, not all homes may be safe, not all the streets may be safe, and vulnerable members are at risk of abuse and exploitation. Even as governments adopt various measures to stop the spread of the virus, it is important to remember their human rights obligation to ensure the protection and fulfillment of the rights pertinent to girls, and especially at this time when these girls are most vulnerable to abuse and exploitation. I recommend as follows. 1. In addition to COVID-19 prevention guidelines, government awareness raising messages should explicitly advocate for safety as people continue to observe prevention measures at home. The government should publicize response mechanisms for women and girls at risk of sexual abuse and exploitation, including survivors of gender based violence and women access to antenatal services during curfew hours. There's need to scale up technology supported mechanisms for reporting, such as SMS alerts to alert or to call for a response when cases occur, and especially during curfew hours. There is also need for the courts to adopt innovative strategies of conducting hearings, noting that normal court hearing procedures have been disrupted by the pandemic. This will help to expedite prosecution of sexual offenses despite the delays that are notable right now. There is also need for heightened advocacy on the prevention of teenage pregnancy, including laws that protect teenage girls from defilement and comprehensive sexual education. Access to maternal health care should be accessible to pregnant girls without stigma or discrimination. There is need for national and global fund allocation towards response to GBV, as well as addressing the particular challenges facing young girls and especially adolescent girls. These funds should also enable you know or be able to generate or create alternative shelters for girls at risk of violence and exploitation. There is need to provide free sanitary towels for girls in disadvantaged areas during this time when such commodities constitute a heavy expense to the girls. On HIV, access to HIV testing and treatment should be convenient, accessible, and youth friendly, including delivery of medication to young people whose clinical visits have been frustrated by the pandemic. There is need for adolescent girls living with HIV to be supported with food and nutritional supplements to further boost immunity during this time. And lastly, there is need for equal representation in COVID-19 response and decision making, ensuring that youth and particularly young women are adequately given a platform to express their needs and interests. These groups ought to be consulted and participate in the COVID-19 response programs and policies. And with all these remarks, I hope and it is my very sincere hope that these challenges will be taken into consideration, and as we continue to fight to defeat the pandemic, we will be able to put the interests of adolescent girls, of young girls, at the heart of defeating the pandemic. Thank you very much.